Let's talk of oocyte cryopreservation for patients with endometriosis. Where are we now? So let's look at this paper. Endometriosis affects young women of reproductive age at about 6 per thousand between 30 and 34 years of age. This condition can significantly impact fertility through inflammation, adhesions, direct impairment of the ovarian reserve. Oocyte cryopreservation or egg freezing is known as a fertility preservation technique and is in fact a preservation strategy for women with endometriosis. However, the current evidence is not backed by very good data. So this systematic review looked at, what do you look at? 10 observational study, looked at types of endometriosis of endometriomas with or without endometriosis, patient population 1,110, and assessment of these cases. Now, if you have a look at the age impact has the most important impact. Total number of oocytes decreased with age, with better outcomes under the age of 35. Surgical history, if you had a previous surgery done for endometriosis, that significantly reduced the total number of oocytes or eggs you could obtain. Type of endometriosis, endometrioma or deep, did not affect the total number of oocytes. Unilateral or bilateral, and the size did not impact again the oocyte yield, though this was inconsistent, and certain studies showed that it did change the number of oocytes obtained. The number of oocytes obtained between 8 and 13 per patient and between 5 and 9.5 per cycle. Women with endometriomas, that is endometriosis with a cyst, had significantly fewer oocytes retrieved to the infertile women, suggesting that there's no doubt that there is a change in. So if you look at the metaphase 2 sites, it seems to be very much the same in endometriosis and non-endometriosis. So at present, what do we know? We think there's a limited data on patient return rates. There's a wide variation of patient returning. Follow-up duration between one study reported timing average of 1.7 years, and there was no data on spontaneous pregnancies. So that's one of the reasons why we still are not entirely sure of what's happening. So we look at the live birth outcomes, 46.6% live birth rate of those who returned, 21% from those who underwent egg freezing, and when you had about 22 eggs, the live birth rate reached about 89.5, which is quite good. Again, these were significantly higher when women were less than 35 years of age compared to those who are more than 35 years of age. Again, remember, a small number of patients, so that data is still quite limited. What affects success rates? First and foremost is the age. Second, if there's been surgery done, that again reduces the oocyte yield, and the live birth rates are significantly better in the non-surgical groups for younger patients. Oocyte quantity, again, live birth rates increased with more oocytes. And multiple stimulation cycles improved cumulative oocyte yield. The main challenge for endometriosis patients is a lower number of oocytes. While if you tended to get 20 plus oocytes, the chances of having a live birth rate significantly got better. But the question is, with endometriosis, will you get so many oocytes? So the current evidence is limited. Advises 2 egg freezing before surgery. There continue to be knowledge gaps. And we are not entirely certain yet what is the best strategy, but it is generally encouraging that pregnancy rates do go up. The more eggs you have, the better. With endometriosis, you're more likely to need more treatments. And as time goes by, we'll end up having more details.